Welcome back to Coffee Break with Paula and Bob, and our first guest, Dr. Steven Teitelbaum. Steven, welcome. It's nice to have you here.
Thank you very much.
Steven is on staff at St. John's, and he's a plastic surgeon, and he has a very interesting career to talk about, and we're catching up on some old-time stuff. We grew up in the same part of town, and he's remembering some things that I had forgotten about growing up.
You were a great football player for the Rams.
Thank you, Steve. All right. I got to say something about you as a great doctor.
Well, and he also spent some time in my old town. You trained in Boston?
I did my general surgery residency at Beth Israel in Brookline.
Where were you before that?
I was at UCLA Medical School, and before that, Berkeley for college.
Been coast to coast, learning your craft.
And you learned about medicine, I guess, at home at an early age.
My dad's an ophthalmologist on staff at St. John's, and my mom's brother is a neurosurgeon on staff at St. John's.
Over the territory.
I volunteered in the emergency room there when I was in college, so I have a very old ID tag for St. John's.
Let's talk a little bit about plastic surgery. There are a lot of people, particularly in the boomer generation and older, who are either electing to have it, or in some cases if they're involved in accidents or have medical problems that require it. They're coming to plastic surgeons increasingly. Plus we have all these TV shows, and we'll get to that in a little bit. Tell us a little bit about your practice.
I specialize in aesthetic plastic surgery. All plastic surgeons, we call it the surgery of the skin of the body and its contents. So we take care of all the problems that are related to cancer, birth defects, deformity, trauma, in order to make a person who's had a problem to bring them back to normalcy.
In terms of their physical presence?
Right. That's the backbone of plastic surgery. But some plastic surgeons, and I'm one of them, specialize mostly in essentially normal people and trying to just enhance a figure in an otherwise normal person.
So is most of your surgery that would be considered elective for most
I do
folks?
Almost only elective surgery.
What does the word plastic mean? Where does this word come from?
Yeah, that's not the best term.
It's not the best term because people think plasticky and fake.
Right.
Well, actually, the petroleum product plastic and plastic surgery both come from the same Greek word plastikos, meaning to mold. So we actually predated the petroleum product, and we have nothing to do with it other than that.
And plasticity actually has many meanings in medicine, doesn't it?
Right, well, plasticity, again, comes back from the word to mold, and in plastic surgery, we're molding a person's features. So we mostly think of the word plastic in association with a piece of plastic, but in essence, the word plastic and plasticity, as you're saying, just comes from the Greek word, which means to mold.
Unlike a lot of our physician guests that have specialties who might get referrals from other members of the medical staff, I would think a lot of people might just, from word of mouth and so forth and pleasant experience, you might hear from people directly.
I do get referrals from doctors because oftentimes a woman may ask her gynecologist for a recommendation for breast surgery or their general surgeon to do a tummy tuck. But more often than not, you're right. The sources of referral are either other patients or educated women are using the internet, and they're reading on the internet and learning, and that's the way they find their doctor.
Well, and again, we were going to hold this off, but maybe this is as good a time as any. There's a lot of misinformation, isn't there, through these TV shows that are out there, these nip-tuck shows?
Yeah, then there's a lot of mixed emotion among plastic surgeons about these sorts of shows, as you're saying, because these are, for instance, Extreme Makeover does have the word extreme. That's not the typical makeover. So just like someone on a game show, a quiz show, is so brilliant, knows the answer to everything, and that's an extreme example of knowledge, that's an extreme example of what we do in plastic surgery. But what a lot of plastic surgeons are fighting is that these shows give the notion that the risk is less than it actually is, and that the result is obtained more quickly and more predictably than it actually is.
So, if, for instance, on those shows, what appears to take just a few weeks may in fact take a year or two if you're talking about 3 or 4 or 5 procedures and recovery and then whatever else goes on after that.
Yeah, St. John's, you know, we have a cleft palate program where we have kids that are really involved with us for many, many years, and those programs take, you know, through their whole growth cycle.
Well, that's right. From birth to adulthood, they have a number of operations, and the doctors at the cleft team at Santa Monica are some of the most known and best cleft surgeons in the entire world, literally.
So, well, back to the business of selecting a plastic surgeon and the kind of work that you do. Do you find that you see as many men as women, increasingly or men in increasing numbers, I guess is the question?
The numbers of men are increasing. In my own practice, men are still about 10%. And we're seeing men for things such as liposuction of their love handles. Even very fit men with six-pack abdomens still frequently have love handles, or men get liposuction of their neck, or a lift or a tightening of their neck, or of their eyes. But men are still much more private about it than women are. And they're very demanding about the surgery being very indistinguishable so that no one can look at them and tell that anything was done. And we can do that increasingly for men.
haven't been to your office, but I'm thinking about the HIPAA requirements and the confidentiality of some things and the privacy of what you might be working on. Is your office different than most physician offices? I mean, is there?
I think that since HIPAA, all doctors are extremely careful
You
about
should tell
the privacy.
people what HIPAA is. What is HIPAA?
Well, it has to do with patient
Well,
privacy
I bet you
rights.
Stephen can tell us what it stands for.
I can't even remember. It's Health Information Privacy and something Act,
Close enough.
an Accountability Act, something like
There
that.
you go.
And, well, doctors always have confidentiality. Whether you're seeing a doctor about a toothache or anything, the doctor can't release or reveal anything about your records. And HIPAA had a lot more to do with electronic transmission of records and stuff. And it also talks about locking up charts. And in point of fact, it didn't really change much from what we were already doing, other than we have to have patients sign certain forms. But yes, we were always very private, records locked up, and nothing transmitted electronically.
Before we go to breast surgery and women.
Yeah, and I want to ask him something about his background as well.
Oh, okay. We want to do that first?
Well, I'm just thinking about, okay, I don't want to pick on my face, but let's just talk about my nose for
Your
a second.
face?
Let's say
about
I wanted to come in and I wanted to have a nose enlargement because my nose is undersized.
You want to have an enlargement?
Yeah, I'm just being a little facetious. You must have, as a good plastic surgeon, you must have some artist in you, or you'd be able to envision what you might make someone over to be.
There are two answers to your question. The first is, I don't pretend that I'm an artist. I think I have a good aesthetic sense, and I think I have a very good sense of what would look good on an individual person's face. But usually a patient will come in and they don't just say, what do I need, or what do you want to do to my nose? Usually they'll say something very specific. They'll say, you know, I have this bump and I don't like the way things look in profile.
I don't like the bridge, or I don't like the nostrils, or something like
Correct.
that.
And
Well,
most
you've got a great nose. What don't you like?
Let's get off the nose.